Imagine the Republican Party, after years of vowing to overhaul America's healthcare system, suddenly hitting a massive roadblock over one of the most divisive topics imaginable: abortion. It's a powder keg that's threatening to blow up their long-awaited healthcare strategy right when they need unity the most, and voters are watching closely. Tensions are boiling over in Congress, where heated debates about abortion are potentially sabotaging the GOP's chances of crafting a comprehensive healthcare agreement. For those new to this, the Affordable Care Act, ACA, often called Obamacare, is the 2010 law that expanded health insurance to millions of Americans through subsidies that help lower premiums. But with those subsidies set to expire by year's end, any holdup in passing new legislation could turn disastrous for Republicans politically. Families across the country are already grappling with soaring healthcare expenses. Think premiums jumping 7% or more next year. And the party is under fire from constituents demanding relief. Meanwhile, President Trump is aggressively advocating to dismantle Obamacare entirely, floating ideas for a mysterious Trumpcare alternative that's short on details but big on promises of more freedom and lower costs. So far, the real fireworks have been happening out of the public eye, through whispers and indirect signals. Reports from Capitol Hill suggest a White House proposal was making the rounds, proposing a temporary 2-year lifeline for those ACA subsidies. But surprise, President Trump skipped a much-anticipated announcement on a Monday, and crucially, this draft sidestepped the abortion controversy altogether. That omission left many lawmakers stunned, especially since Republican leaders and influential lobbying organizations have been vocal about wanting to tighten the ACA's current rules on abortion funding. Under the existing setup, federal dollars can't directly pay for abortions thanks to the Hyde Amendment, a long-standing policy that blocks taxpayer money from covering the procedure in most situations, except in cases like rape, incest, or life-threatening emergencies. However, some states dip into separate state funds to offer abortion coverage in ACA marketplace plans, which has irked conservatives for years. But here's where it gets controversial. The White House seems reluctant to dive headfirst into this fight. When pressed on the administration's healthcare blueprint and Trump's views on abortion, spokesman Kush Desai shared with The Independent, the existing framework isn't cutting it for providing affordable care to regular folks. Handing more cash to insurance giants, as Democrats propose, isn't the fix President Trump has in mind. It's a clear signal that the president prioritizes cost control over reopening old wounds, or is it a strategic dodge? Enter Senator Mike Rounds from South Dakota, who's drawn a hard line. No Republican support for extending subsidies without beefed-up abortion curbs. Taxpayer money absolutely shouldn't support abortions, he declared earlier this month to NBC News. He acknowledges Democrats see it differently, but insists the GOP is united on this front. For beginners, this underscores a core ideological split. Conservatives view any indirect funding link as morally unacceptable, while opponents argue it's about protecting women's access to comprehensive care. And this is the part most people miss. Abortion has become an unspoken deal-breaker for a chunk of Republicans, especially if Trump calls on them to back an extension of his rival's flagship law, something the party has battled to repeal since 2010. Patrick Brown, a researcher at the Conservative Ethics and Public Policy Center, pointed out to Politico, everyone knows this team isn't eager to burn political energy on abortion unless forced. It's not a spotlight they want. Yet, to seal any deal, the administration might have to flex its muscles and push those restrictions through, knowing it'll tick off one side or the other. On one hand, pro-life advocates are ready to pounce. Take Susan B. Anthony Pro-Life America, a powerhouse group that's vowed to punish lawmakers who vote for subsidies without ironclad abortion bans. We can't back any healthcare package missing this vital protection, warned President Marjorie Dannenfelser in Politico. Their stance is rock solid, no compromises. On the flip side, Democrats in Congress are drawing their own boundaries. Almost none would greenlight expansions of abortion limits beyond the ACA's original height-compliant design. Hawaii's Senator Brian Schatz even called the whole debate a smokescreen, telling NBC News that Republicans are using abortion as an excuse to mask their internal chaos on health care, a problem that's haunted the party for over a decade. Bringing up abortion restrictions? That's code for admitting they can't muster the votes for a straight extension, he said. It's a bold accusation. Is this genuine principle or political theater to buy time? Even setting abortion aside, Republicans are fractured on the bigger healthcare picture, racing against a mid-December deadline to act on those subsidies, a concession made to Democrats during the recent government shutdown talks. In the Senate, echoing Trump's vision, some propose swapping ACA aid for Trump health freedom accounts, think government-backed health savings accounts, HSAs, that let people save pre-tax dollars for medical needs, paired with rules allowing insurance shopping across state borders to foster competition and drive down prices. For example, this could mean a family in California buying a cheaper plan from a Texas provider, potentially saving hundreds annually. Meanwhile, the business-friendly Republican Main Street Caucus is pitching a middle ground. Stretch the subsidies but add stricter income caps and premium rules to weed out waste and fraud, aiming to make coverage more efficient without a full overhaul. Trump himself has flip-flopped a bit, once insisting he'd only back plans that ditch insurer subsidies for direct-to-consumer funding, but lately hinting he'd tolerate a short ACA extension if it paves the way for sweeping reforms. No matter the path, the GOP can't ignore the mounting pressure healthcare costs are primed to climb even higher in 2026, hitting wallets hard during open enrollment season that's already underway. Millions are budgeting for those premium hikes, and come the 2026 midterms, this could be the election-defining battleground. So what do you think? Is linking abortion restrictions to essential healthcare subsidies a principled stand or a dangerous distraction that hurts everyday Americans? Should politics keep these issues worlds apart? Drop your take in the comments. I'd love to hear if you're team extension, team overhaul, or something else entirely.